Hello, I'm Hanne Tytgat and I'm a scientist working at Nestlé Research. There we strive to understand human milk. We know that human milk offers a complete nutrition for child development. Human milk is the gold standard in early life for nutrition for the baby. It offers a lot of benefits to the infant. It helps to protect it from infections, from caries, or for instance, it also helps to improve cognitive development. And we have seen that it also reduces the chances of the child developing obesity and diabetes in early life. Also, we have seen that there might be a potential also effect on the protection from allergies. This human milk nutrition not only has a benefit for the infant, it also has many benefits from the mother. It not only helps her to protect herself from breast and ovarian cancer, but it also increases the spacing between births. Human milk contains all ingredients to support child development. It contains nutritive components like, for instance, lactose, proteins and fat that are digested by the infants. They really nurture the infant and like that steer its growth and development. While it also contains a myriad of bioactive components. These bioactive components come in many flavors. We have, for instance, cytokines, antioxidants, antigens, immune cells, but also human milk oligosaccharides, HMOs. These HMOs are not digested, all these bioactives are not digested, but they're really there to steer the development of the infant. They help the infant to build the immune system and the microbiome. Because if you look at an infant when it's born practically sterile. It doesn't really have a microbiome yet. The first colonization happens during birth. The infant receives microbes from its mother during the birth. And then we see that over the first weeks and months that a microbiome starts to establish. This is strongly dominated by bifidobacteria. And these bifidobacteria are specifically nurtured by components in the human milk, like for instance these HMOs that I mentioned before. We see that over the next weeks and months of the infant's life that the microbiome diversity increases fast. We see a rapid diversification, more adult-type species start to pop up, and we see that this really coincides with when weaning happens, so when complementary foods are introduced. This is then further established over the next months and years of an infant's life until it reaches a stable microbiome that will serve it throughout life. This microbiome development is really critical because it also goes hand in hand with the immune system development. When you look below the bar, then you see that also the immune system really increases in complexity and is really trained during this early life period. It is trained hand in hand with the microbiome diversification because the immune system needs to learn how to distinguish between good and bad bacteria. It really needs to be trained, it needs to be established, it really needs to mature. So this microbiome and immune system mature hand in hand in early life. And then once they matured, they really serve us throughout life and support our lifelong health. It's really critical that this microbiome and immune system are well established in early life. I do want to shortly glance over some risk factors. Because there are a lot of factors that influence gut microbiome development in early life and that can have a negative impact on this maturation. For instance, the use of antibiotics, delivery mode, but also feeding. And this is where I'm coming back to human milk. Because we know that breastfeeding really stimulates a healthy gut microbiome development. We see that when an infant is breastfed, what we here see in pink, that we really have a slow increase in microbiota diversity, as we see in the left panel. In the right panel, we see the development of trajectory of the bifidobacteria. These bifidobacteria I mentioned earlier, we typically see a peak in early life, and this really is nurtured by components in breast milk. We see that they rapidly go up over the first month of life, we see a peak around 3 months of life, and then we see a decrease in their abundance when the microbiome starts to diversify. When an infant is given cow's milk formula, then we see that which doesn't contain any HMOs, these human milk oligosaccharides, then we see that the microbiome rapidly diversifies. As you see on the left panel, it really goes very rapid diversification, really rapid. We go to a state where the microbiome is very diverse. And when we look on the right, we don't really see this typical peak in bifidobacteria around this first 3 months of life. And this really goes hand in hand with the HMOs. We know that these HMOs are important to steer this bifidobacterial peak, to steer this normal microbiota development that we see in breastfed infants. And that is why we want to know more about these HMOs, for instance. These HMOs, or human milk oligosaccharides, are the third largest solid component of human milk. They range between 5 to 15 grams per liter in human milk, and they're non-digested. They're non-digested elongations of lactose. Over 160 of these molecules have been described. But here, the ones that are listed here, these 20, represent over 80% of the HMOs found commonly in milk. They can be grouped in 3 categories. We have the fucosylated ones, we have the non-fucosylated neutral HMOs, and we have the sialylated HMOs. It's important to note that, as I already glanced on before, that these HMOs are not, or only to a very minor extent, present in farmed animal milks, which often serve as a basis for formula. These HMOs steer, as I said before, the microbiome development. They really can have an effect on, as a prebiotic, to steer for the nourishing and the flourishing of certain bacteria, like for instance the bifidobacteria in the microbiome. Moreover, they also help to weed off pathogens. They have antipathogenic effects. Apart from steering this microbiome, they also play a role in supporting the immune competence development. They help to modulate the developing nervous system, and they also help to steer cognitive development. So we have seen that these HMOs steer a lot of functions in early life development. And that is why we really want to understand how these HMOs do this. What is the mode of action of certain HMOs? That is why we have to reduce complexity, because human milk, as I said before, is a very complex fluid. It's full of bioactive components, full of HMOs, full of combinations. So we need to break down complexity. And that is why we use randomized clinical trials. These clinical trials are the golden standard of clinical research and give us the opportunity to understand how certain HMOs and combinations of HMOs steer certain developmental outcomes. And in the past, we have done research to, for instance, study one HMO, so really to understand how does one HMO work, how does it affect certain functions, how does it affect certain outcomes, but also combinations of HMOs, like for instance 2 HMOs and 5 HMOs. In the next part, I will give you an overview of some of these clinical findings, where we start to unravel and understand how HMOs work. We know, for instance, from a randomized clinical trial that tricylic acid, an acidic or a sialylated HMO, really can help with language development. We see a strong link between 3SL concentrations and language development, how good an infant can develop its language skills. Another HMO, 2-fucosylactose, part of the fucosylated human milk oligosaccharides, correlates stronger with cognition scores. The concentrations of 2FL over the first month of life correlate strongly to cognition scores over the first 2 years of an infant's life. So we see that these HMOs also help to steer cognitive development. Other roles of HMOs we have elucidated and we have discovered from studying 2 HMOs in randomized clinical trials. There we saw that HMOs help to reduce respiratory infection morbidity and medication use. We saw that infants that received a formula supplemented with these 2 HMOs, in this case 2FL and LNT, that they had a reduced risk of needing antipyretics over the first 4 months of life, compared to infants that got a control formula that did not have these HMOs there. We also saw that these infants had a reduced risk to require antibiotics over their first year of life, and also had a reduced risk to experience low respiratory tract infections and bronchitis over the first year of life. This really wondered us and made us dig deeper in this medication use. How do these HMOs help to reduce medication use in early life? And there we come back to this concept that I introduced before. We know that in early life we have this typical peak in bifidobacteria. As you see here, in breastfed infants that are vaginally born, we see a very strong peak in bifidobacteria in early life. This is at 3 months of age. Also in C-section born infants, this is the case. But in infants receiving a formula, we see that there is a lower peak in bifidobacterial abundance. That this peak is a bit lower, that we have a lower abundance of bifidobacteria. This is especially pronounced in C-section born infants. Now, what do we see? If we give these infants a formula supplemented with the 2 HMOs, we see that we can increase this bifidobacterial abundance in these two groups. Both in the C-section and in the vaginally born infants, we see a restoration of this bifidobacterial peak, and we see that we have this closer again to what we see in breastfed infants. When we then look at the microbiota community of these infants, then we see that in these breastfed infants, we have a strong abundance of fecal community type B, here in red. We see that in the infants that receive formula, not supplemented with HMOs, that their fecal community type C in green is the most abundant one. Interestingly, in infants receiving the 2 HMOs supplemented in their formula, we see that more infants show again this fecal community type B, moving closer to what we see in breastfeeding. And to conclude the story, we see that this antibiotic use can be correlated to this fecal community type. We see that these infants having a fecal community type B have a lower chance of requiring antibiotic use in the first year of life compared to infants with a fecal community type C. And as I introduced, this fecal community type B is more abundant in breastfed infants and in the infants receiving a formula supplemented with 2 HMOs. To further understand how HMOs can work together, we recently ran a trial where we looked at 5 HMOs. For the first time here, we had HMOs from all 3 big classes of HMOs present. Here we saw a strong influence on gut microbiota composition. When we look at the beginning, then we see that the formula-fed groups, the control group and the 2 test groups, because we tested this 5 HMO supplementation in 2 concentrations, that they all cluster together and separately from breastfed in yellow. But over the months, over 3 months and 6 months of age, and here I show 6 months of age, we see that the microbiota composition, as measured by beta diversity, moves closer to what we see in breastfed for the 2 groups that were supplemented with, that received formula supplemented with HMOs. And that it really is distinctly different from what we see in the control group that received the formula without HMOs. And of course, also here we will have a look at these important bifidobacteria. In general, the relative abundance of bifidobacteria really goes closer to what we see in breastfed infants in the 2 groups that receive the HMOs. And here I highlight specifically on the right Bifidobacteria longum subspecies infantis. This bacteria is really known to be a key HMO utilizer. It can utilize the HMOs in breast milk and really utilize these HMOs to grow, to nurture, to feed and to steer the microbiota. So these go hand in hand. And indeed, what do we see? Is that compared between the control group and breastfed, we have a stronger abundance of this species in breastfed. And in the 2 groups that received the 5 HMOs, this moves closer to breastfed and is significantly different. We see a higher abundance of this Bifidobacterium longum subspecies infantis in the 2 groups that received the 5 HMOs compared to the ones that didn't. But there's also an effect on the functional maturation of the gut, not only on the microbiome. Here we look at 2 important markers of gut functional maturation and immunity. One of them is the gut permeability marker AAT, or alpha-antitrypsin. We know that this alpha-antitrypsin, the lower we have it, the better it is, the less permeable a gut is. So this is of course where we want to go. What we see is when we compare the control group and the test groups, the ones receiving the 5 HMOs, we see that there is a significantly lower abundance of this marker of gut permeability, so showing that we have a less permeable gut. Here I did not depict the values for breastfed infants because this protein is also present in breast milk, so you cannot really compare. When we look at the gut immunity marker SIgA, which is a gut gatekeeper, it's really an immune gatekeeper helping to contract pathogens and really to steer the immune system. Then we see that the abundance of this marker really significantly increased in the groups receiving the HMOs, moving closer to breastfed and being significantly different from the ones that only received a formula not supplemented with the HMOs. So here you see how you really, using randomized clinical trials, start to unravel how HMOs work, what their mode of action is, and how they steer early life development of an infant. To conclude, I have shown you that HMOs are key bioactives in early life, and that early life is really a critical window for the development of the gut microbiome and immune system. That a resilient microbiome is then there to serve us for long-term health. It's stable, it helps us to weed off infections and to remain healthy. And many factors can really influence this early life window of opportunity in which these systems are developed, like for instance the microbiome and immune system. We have, for instance, seen the detrimental effect of, for instance, formula feeding and antibiotic use. We also have seen that human milk is really the golden standard of feeding in early life. It contains not only all nutritive components, but also all bioactive components to steer the optimal development of an infant, but also of its microbiome and immune system, and so on. Especially HMOs we have studied in great detail. HMOs specifically nurture in microbiome maturation, and also we have seen that it also has a myriad of other functions. It's related to, for instance, cognitive development, but also to a reduction in infections, and so forth and so on. We only start to begin to understand how HMOs work together, and also how HMOs work together with all other bioactives in early life. And this is what we need to understand more in the future. We really strive to understand how human milk works, to understand how do HMOs work, how do HMOs work together, also with other bioactives, to steer this early life development. We know that it's important to understand the bigger picture, to understand synergy between different components in human milk, between different bioactives, to show causality, to understand the mode of action of these components not only alone, but also in context. We really need to understand how all these components work together. And therefore it's important that we have these randomized clinical trials, for instance, where we can reduce complexity. We can really look at certain components, like I showed you for the HMOs, to really understand how these steer the development, alone or in a conjunction with other components or other HMOs. But also it's important that we start to look at human milk as a whole, that we also look at early life development as a whole, that we do more integrative analysis, that we look via using omics, systems biology, and really look at the whole network, that we start to understand how all these components and little things work together to give infants the best possible start in life. I want to thank you very much for your attention.